How to stop biting those nails. Whether you're a nail biter or the caregiver of a child who bites their nails, this is the video for you. I'm going to be giving you practical tips to stop biting your nails. The medical term for nail biting is onychophagia. Nail biting is a chronic and repetitive habit, can be compulsive in nature. Just like other repetitive compulsions like skin picking disorder or pulling one's hair, this can be triggered by stress and it may be associated with an underlying anxiety disorder. About 20 to 30% of the population is a nail biter. It's a lot more common in young children, but they frequently outgrow it. However, it definitely does persist into young adulthood, older adulthood for certain. Everyone experiences their nail biting differently. Some people are conscious of the fact that they bite their nails, they know they're doing it, whereas for other people, it's just, like I said, a compulsion. They don't even make the connection that they're doing it, they're not aware of it. It also can be, to some extent, possibly related to genetics. For example, if your parents are nail biters, it's a lot more likely that you will bite your nails. If you are an identical twin, it's more likely that both of you will bite your nails versus if you are non-identical twins. Because nail biting can be experienced differently from everyone, the approach to managing it is going to be quite different. Some people, the tips I'm going to give in this video may be the solution that you need. They may be just enough, just a few behavioral modifications, and you'll be on your way to never biting your nails again. Whereas for other people, they're going to require more intensive of an approach, maybe a multidisciplinary approach involving multiple different types of healthcare providers like a psychologist. It's labeled as a body-focused repetitive behavior. Now, another body-focused repetitive behavior is skin picking disorder. If you suffer from that, you're definitely going to want to check out my video on skin picking disorder. I give lots of tips and tricks in that video as to how to stop. Nail biting is very similar. They're kind of like cousins in terms of a maladaptive behavior, often triggered by stress. A lot of patients who have a nail biting disorder, they do have other comorbid mental health problems. About 25% will have anxiety and or obsessive compulsive disorder. Risk factors for nail biting, I already talked about. Family history. If both parents bite their nails, you're more likely to do it. Could be genetic, or it could just be that you see your parents doing it, you start doing it. For young children, there's an association with prolonged bottle feeding or letting the child use a pacifier for much too long. If it goes on too long, it kind of becomes this self-soothing behavior, kind of can lead to thumb sucking, and then nail biting is sort of like an extension of that. Why should you try to stop biting your nails? First of all, it really can cause a lot of distortion of your nails. Nails are not just an aesthetic thing, they are functional. They help us with touching things, picking things up. Biting one's nails can really disrupt the nail growth, can lead to distorted nails, and it can shorten the nails. So it can damage your nails, but probably the most pressing issue, what we see a lot in dermatology as it relates to nail biting, is infections. So you can get infections in the skin around the nail. It's called a paronychia. It can be a bacterial infection, very painful. You also can get a variety of different viral infections there. For example, not uncommon for nail biters to get a lot of warts around their nails, but also, you've got to consider the fact that you are putting it in your mouth. We often see warts around the mouth in nail biters. That wart virus gets transferred from the fingers to the mouth. Also, if you weren't aware, herpes simplex virus is everywhere. We all have it in us. And for a lot of people, they have it wake up randomly in their body, they shed it. Maybe they don't even realize it's happening, and they're shedding it in their saliva, put their finger in their mouth, bite, introduce that virus around the nails. You get this very painful herpes infection of your finger. It's called herpetic whitlow. The mouth of nail biters is a lot more prone to infection. They even have a different constitution of bacteria in the mouth. They have a higher bacterial load, specifically of a type of bacteria called Enterobacteriaceae. They often have poor dental hygiene as a result of nail biting, and it can lead to inflamed gums, gingivitis, also more frequent dental problems. Putting your hand in your mouth all the time, you're more likely to get sick. And that biting pressure can really damage your teeth. It can lead to chipped teeth, notches in the teeth. That biting pressure can also lead to small fractures of your incisors. It can also just really mess up not only your teeth, but your bite. It can cause what's called malocclusion. My number one tip when it comes to at least helping someone break the habit is to not shame or punish. If you have a child who bites their nails, do not punish them for doing this. We know that not only does that not help, but it tends to make it much worse. Go-to recommendation I often suggest, depending on the severity, is aversive therapy. Basically, you can buy a nail lacquer to paint on the nails that tastes really horrible. So when the child puts their fingers in the mouth, or you put your fingers in your mouth to bite your nails, tastes terrible. That kind of, can clue you into the fact that you're doing it, and it sort of helps to break the cycle. Now, some people who have more serious mental health issues around nail biting, maybe you have obsessive compulsive disorder, that may not necessarily be the most helpful thing. Aversive therapy can be kind of part of a three-part strategy to increase awareness and stop the behavior. And part of that strategy is first to kind of remove some of the triggering factors. And the main way to do that with the nails is to keep the nails cut short. I think we can all empathize, at least to some extent, with nail biters, because if you've ever broken a nail and it's like super jagged, it's really hard to not bite it, okay? I don't deal with nail biting, but if I'm somewhere and I have broken a nail and it's like really jagged and it's snagging on everything, you get desperate and you just want to bite it. For someone who is already biting their nails a lot though, they have, a lot of these kind of uneven parts to the nail already broken, and that serves further to fuel the behavior of wanting to bite the nails. So keeping them cut short is key. For some people, having their nails a little bit long and keeping them manicured, that actually is an incentive to not bite the nails. If you are that person, but you end up somewhere and you break a nail and it kind of triggers you to want to bite, try making sure that you keep with you nail clippers so that in the event that that happens, you could just go ahead and clip the nail smooth and short. The other part of the behavioral intervention is to make it more difficult to bite your nails by covering them with a bandage. And another thing that can help a lot of kids is just get some gloves, put socks on the hands, like when they sleep, because some kids might do this in their sleep, or you might do that in your sleep. As a side note, you can get these cotton gloves, and I recommend this anyway for like dry hands, but it's great to at nighttime put plain petroleum jelly on your hands and cover them with gloves. But if you're someone who deals with nail biting, this is also a helpful thing to do because of a few reasons. First of all, you have the gloves on there that kind of serve to remove the nails from access. Kind of like when we talk about with skin picking disorder, I tell you guys about the pimple patches to act as a barrier from your fingers. This is kind of the same exact principle. But the other reason it's helpful is that the plain petroleum jelly under occlusion of that glove, it actually can help quite a bit with any roughness of the cuticles. It can help cut down on hangnails, which themselves are also a trigger for nail biting. Then of course, the third aspect is to remove the positive reinforcement that people get subconsciously with nail biting, and that comes in the form of the aversion therapy by painting the nails with that foul tasting stuff. There's a brand that you can buy at Target. It's called Ella and Mia, and they also sell it on Amazon. It's a nail polish company, but they specifically make a nail lacquer that tastes foul. It's called No More Biting, I think, and that's a great option. Along those lines though, for a lot of really young children, like if if they're really upset by the foul tasting stuff and it's becoming very stressful for them to have that on there, another thing that's actually been found to be helpful for young kids is to just put olive oil on their nails. Something about the olive oil just makes the nails feel smoother, and it kind of cuts down on that urge to bite any roughness. The other thing that really can make a huge difference, no matter where you're at in your nail biting journey, is nail hygiene. First of all, it makes a huge difference if you are biting your nails to at least keep them clean, because if they're dirty and you're biting them, well, that just increases more risk. So washing your hands regularly, washing around your nails, keeping your nails cut short, it can definitely make a difference because it's less territory for you to bite. And then from a hygiene perspective, less territory for stuff to stick onto the nails and for you then to introduce close to your mouth, cause infections, problems, and the like. But that being said, there's kind of the other side of the coin where for some people having their nails manicured regularly really can serve as a huge motivating factor to not bite their nails. Like a lot of parents of teens, tweens who are nail biters, if you acquiesce to letting your child get professional manicures, that actually can serve as a motivator for them to not bite their nails. I mean, we all know that getting your nails done, it's an investment. It's expensive, looks great. The last thing you want to do is get your nails done and then bite the nails and ruin your manicure. So it can serve as a motivating factor, but it is, you know, obviously an expensive thing to keep up with. But some people are going to need therapy to stop biting their nails. And there are different types of approaches to therapy. Now, I'm not a psychologist or psychiatrist, but I do have familiarity with just the basic tenets of how these different styles of therapy work. Cognitive behavioral therapy is based on both the behavior and a cognitive model. Essentially, with cognitive behavioral therapy, it really works to address the maladaptive behavior. And this is something that I brought up in my video on skin picking disorder as, you know, a psychologic approach, a therapeutic approach to breaking the habit. Some people really benefit from a type of therapeutic intervention called a functional analysis therapy, because basically for some people, they're going to be triggered to bite their nails in certain environments or under certain circumstances. So this therapy involves being observed in different situations or different circumstances to kind of find out what scenarios are associated with increase in nail biting for you, and then that way individualized recommendations can be made based on those observations of what situations are triggering you. The aim of functional analysis therapy is to reduce the behavior to a point where it finally just goes away. Habit reversal therapy. This is something I talked about in my video on skin picking disorder. As a side note, maybe you do both. Maybe you bite your nail and you pick your skin. Not uncommon. You're not alone. It's pretty common out there. So habit reversal training is another approach to therapy that basically helps you to form an awareness around the habit and identify alternatives to the habit. So instead of, you know, figure out what it is that triggers you to bite your nails, circumstances, situations, feelings, and once you have an awareness of that trigger, but instead of biting, you are taught to start training yourself to do something that is more helpful, less harmful to you. So, for example, instead of biting your nails, keep some gum with you. Like, for example, if you know every Tuesday I have a meeting with my boss and I start biting my nails around that, you know, an hour before that meeting, having gum with you and say, okay, I'm gonna start chewing this gum right now, it really can help serve to break that cycle. And then another part of the habit reversal training really is also enrolling a social support system. So again, this is where, you know, if you have a child with this, your reactions and your responses are key. You wanna be as supportive as possible. You don't wanna make this punitive, punishing the child or, you know, putting the child down, scolding the child, not helpful. Likewise, if you are in a relationship with someone who does this, you don't want to make comments like, oh, that's so gross, why do you do that? Some people are going to need medications, pharmacotherapy, you know, especially people who have a lot of, you know, more of the obsessive compulsive type disorders or comorbid anxiety. Medications may be indicated. SSRIs, fluoxetine, antidepressant can help quite a bit for some people, cut down on that compulsive behavior. Let me know if you have ever heard of the dietary supplement N-acetylcysteine. I'm sure you have. A year or so ago, it was getting a lot of attention. N-acetylcysteine, it is a dietary supplement that works by modulating something called glutamate. For whatever reason, N-acetylcysteine really seems to help patients a lot with these body-focused repetitive disorders like nail biting, hair pulling, trichotillomania, pulling at your eyelashes or your eyebrows, or skin picking. 800 milligrams of this taken a day for a month can reduce nail biting. So it's definitely something that has a track record of being effective for this. Again, it may not be necessary. Like I said, some of the tweaks we already talked about, the gum chewing thing, the awareness, that might, you know, get you where you need to be. For kids, a reward system can be really beneficial. If you're the caregiver of a child who does this, you know, you could think about setting up a sticker reward system where basically every day they go without biting their nails, they get a little sticker, and then, you know, maybe you say, if you get a sticker every day for 2 weeks, you know, you can pick a prize. That type of reward system tends to actually work really well for kids. I'm a big proponent with these disorders too of like, trying to keep a little journal. It doesn't have to be some fancy diary or anything, just a little notebook where you write down every time that you realize that you're biting your nails and, you know, the circumstances, so you can identify triggers, and then you can start replacing those triggers with, you know, less harmful things, like squeezing a little stress ball, or doing a craft, a hobby, getting up, going outside for a walk to calm down. Try and have a plan in place. That mindfulness around the behavior, it's very empowering for patients to take back control. A, you learn what it is that sets you off, so you have a better understanding of yourself. And then B, you take charge of the behavior and you redirect it. As far as kids go, you know, they're still growing and developing, and so that might be, you know, they may not have the ability to really think that way yet. But there is a book. It's called What to Do When Bad Habits Take Hold by Dr. Huebner, a psychologist. It's illustrated. It's great for kids like in elementary school age, and it gives very practical, helpful tips on how to stop doing things like nail biting or hair pulling. It's a really useful tool for children. So I'm going to link that down below in the description box, along with the Ella and Mia nail lacquer. So those are the tips. I really hope this video was helpful to you guys who struggle with this. I know it can be socially isolating, and like I said, it can lead to a lot of health problems down the road, infections, which you want to avoid. Taking control of it now, no matter where you're at in your journey, can definitely pay off dividends in the long run. So speaking of these body-focused repetitive disorders, on the end slate, I'm going to link my video on skin picking disorder. Make sure you check that one out if that's something you also deal with. Make sure you check that one out if that's something that you deal with. I give a lot of tips and tricks in that video. But if you guys enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.